Good morning, everybody, and welcome. We are going to go ahead and get started with our webinar, Utilizing Healthy Northeast Ohio for Grant Proposals. Thank you so much for joining us. We are very excited to have you all with us this morning. We do kindly ask that you please keep your microphones turned off in order to maximize our audio quality for today, and it looks like most of you are abiding by that, so we appreciate that. If you do have questions that arise or even just comments during our presentation, please add those to the chat. And I know many of you have done so as you were entering the webinar this morning, but please do add your name and organization to the chat just so we know a little bit about who is joining us today. My name is Libby McGraw. I am the Regional Community Health Improvement Manager for Healthy Northeast Ohio. I am based at the Center for Health Affairs in Cleveland, Ohio, and I serve as one of two local site administrators for healthyneo.org. And Sarah, I'll go ahead and invite you to introduce yourself.
Thanks, Libby. Good morning, everyone. We really appreciate you joining us today. My name is Sarah Zabo. I am a data analyst at the Cuyahoga County Board of Health, and I serve as Libby's counterpart as another website administrator for Healthy Northeast Ohio.
Thanks, Sarah. We are very excited to see such a positive response for today's webinar. So again, thanks so much for joining us. We are going to share a little bit of background information about Healthy Northeast Ohio to kick us off. I know there may be some individuals on the call today who might be newer to our website. So we want to make sure we just highlight a little bit about who we are just for some level setting. We are also going to share a couple of exciting updates and announcements in relation to healthyneo.org, but the majority of our time is going to be spent demonstrating on healthyneo.org, and we will be showing how the website can be utilized for grant proposal. And of course, we will leave time at the end for questions. Our mission is to improve and support community health across a 9-county region by providing stakeholders with access to vetted population health data and resources through a publicly available platform. My organization and Sarah's organization, the Center for Health Affairs, and the Cuyahoga County Board of Health work collaboratively on Healthy Northeast Ohio. As you can see here, we did launch back in 2019. We utilized the Conduent web-based platform, and we work very closely with many of the hospitals and public health departments across our region, in addition to a couple of community-based organizations and coalitions. And we continue to be supported by a grant through the HealthCom Foundation and through partner contributions from across our region. So to all of our partners and all of our financial supporters, we just thank you so much for the continued support. Overall, Healthy Northeast Ohio can be very effective in understanding and exploring the needs of a community, prioritizing health needs. There's a lot of functionality on the website where data can be visualized in very dynamic ways. And all of this can assist with all of your efforts in taking action and ultimately influencing change in your community. So again, we have a couple of examples here on the slides of ways in which Healthy Northeast Ohio can be utilized to support community health efforts. And for the sake of our webinar today, we are going to be focusing specifically on grant applications and how it might support you in that work that you're conducting. We do want to call your attention just for a couple of moments to a few updates that are going to be particularly helpful after today's presentation. We are going to be sharing a lot of information, and we know it might be a little overwhelming, so we just want you all to be well equipped with the tools that might help you with navigating Healthy Northeast Ohio after you leave our event today. So a reminder, on healthyneo.org, we do have a very comprehensive how to use the site page, and it is on that page that you can find a couple of the tools that we're going to mention here. So first up, we do have a website user guide that can be found on this page, and that includes a step-by-step instruction to help you navigate Healthy Northeast Ohio. It's a pretty large document, but it does go step-by-step into a lot of the different features that Sarah and I will be sharing today. And on that same web page, we also have a series of very brief video tutorials that may assist you with navigating some of the features today as well. So if following a video tutorial is a little more appealing to you than reading through the document, this might be a great way to, again, refresh your memory on how to use some of these tools. And again, these can be very useful if you're newer to the platform, or even if you're somebody who hasn't visited the website in a couple of months, just to give you that refresher. I will say all of these are about 5 to 7 minutes, so none of them are too long, and we do just encourage you to use those, and they're there to support your learning as well. So with that being said, Sarah, I will turn it over to you.
Thanks, Libby. Sorry, I was trying to find my mute button. So again, hopefully now you have a better sense of some background information on the website, and then some of our updated how-to materials that, like Libby shared, we encourage you to check out, especially if you're a new website user. So for the remainder of the webinar, we are going to be sharing how Healthy Northeast Ohio can support grant seekers and grant makers. And on this slide, you're seeing a document that we created that outlines some of the features on the site that can be used to support grant writing and grant reporting. And it's also available on that same webpage that Libby was just referencing, the how to use this site page. And I think Libby also is going to add a link to this document into the chat, just so everyone has easy access to it. So I'm going to turn my camera off as I move over to the website, just to enhance my bandwidth. And Libby, can you confirm that you're seeing the website?
Yep, I see it, Sarah.
Okay, perfect. Thank you. Okay, so we're going to start by focusing on how the site can support those who are seeking grant funding, such as finding data for case building, describing the population your project will serve, goal setting, monitoring progress, as well as finding grant opportunities and best practices to implement. So on my screen, you're seeing the Healthy Northeast Ohio homepage. So welcome to those of you who may be new to the platform. And then for those of you who are familiar with the platform, welcome back. And if you happen to have two screens, I would say feel free to pull one up and have the website open if it's helpful for you to kind of follow along as we showcase any of these features. So to start, I'm going to open our funding opportunities database. So if you're looking for grant opportunities to support your work, Healthy Northeast Ohio does include a funding opportunities database, and this is updated regularly, and it is maintained by our website vendor, Conduent. So in this database, I'll just give the caveat that it does mainly include funding opportunities from the federal government and large foundations, but you can see they're listed by title, and then they also can be organized using these arrows by topic. If you do click on one of the opportunities, it'll just take you to the funder's webpage where you can learn more to see if that opportunity might be a good fit for your project. So again, please feel free to check this out, and that was under tools and resources, the funding opportunities. So next, we're going to share some examples of how data on Healthy Northeast Ohio can support grant writing and reporting. And we know that as a grant seeker, you need to build a case for your project, not just by what the issue your community facing is, but also by backing it up with relevant data. This is the indicator list by location, and it lists the more than 300 health and quality of life indicators that are available on Healthy Northeast Ohio, and they are organized by topics that align with Healthy People 2030. These indicators are updated regularly. I would say most are updated on an annual basis, and they come from more than 30 trusted sources. So those are a combination of local, state, and national sources. And our hope is that having all of these indicators in one place can save you time and can also support you in telling a compelling story in your application. So we encourage you to visit this page, especially if you are newer to the site, so you can see if we have the data that you might be looking for. And I can scroll down just a bit. This page is really long. Don't want to make anyone dizzy, but again, you can just see, cancer related data, children's health, diabetes, etc. And then I also wanted to share that the data on the site is available at geographic levels. So that's all the way from the state down to census tract and neighborhood levels. And you can also use this page to see if we have the geographic level of data that you're interested in. So for example, if you're looking for zip code level data, you would look to see if there is a check mark under that zip code column for the indicator that you are interested in. And having data available at these more granular levels can help with knowing where to focus your project activities. So Libby's going to share a few more examples of how the site can help with project planning in just a bit, but I just wanted to mention that. So next, I am going to briefly walk through how you can find more detailed information about an indicator using the search for data page. So we would love to hear examples from you all about what data you might be looking for related to a grant proposal. So we'll give you just a little bit if you want to go ahead and just add those examples to the chat. Libby's going to monitor that. So again, give everybody just a minute, but again, we're just looking to hear what kind of data you might be looking for maybe a current or even an upcoming grant proposal.
Nothing coming through yet in the chat, Sarah.
Don't be shy.
Thanks, everyone. We have a couple of great ones coming through. Sarah, I'll just mention a couple of them. Infant
Sure.
mortality has come up a couple times, social determinants of health, childhood vaccination rates. And thanks everybody for sharing some of those interests. Sarah, we'll let you go ahead and continue on.
Okay, let's see. I see maybe childhood lead. So I'm just going to do a keyword search for lead. So once you do your keyword search, it's just going to pull up all of your results in this list. So for example's sake, I'll just pick blood lead levels in children. So you would click on that indicator and then you will be prompted to select a location. So I'll just select Cuyahoga County for ease of example. So on this page, which is called the indicator detail page, you'll see that it always starts up top with this "why is this important" text. And that can be used to help frame the issue. And then this page will also include other information that can help to show the importance of it in your community. So to get a sense of how your community is doing, there are a variety of comparisons displayed using, gauges and dials and colors that are located in this compared to section here. So if you do hover over any of these, additional text will pop up to help you, with understanding what does that dial mean or what does that icon mean. You can also use the see the legend option over to the left. So I just wanted to quickly point that out. So when these comparisons are looked at, we can see how is your community doing compared to other locations, maybe targets. How is this indicator tracking over time? And using comparisons, maybe for example, not exactly this indicator, but how might your county be doing compared to other counties across the state or even across the country? That can help to support the need for your project and to put that data into context. These comparisons can also be used to help with identifying areas for opportunity, goal setting, as well as tracking progress for grant reporting. So here we're looking at Cuyahoga County, and it looks like Cuyahoga County's value is higher than the state overall. And then again, you're just looking at how is Cuyahoga County's current value doing compared to the prior value. So it is a little bit lower. And then how is this indicator tracking over time? So this page will also include visualizations. Such as graphs that might show the indicator over time or breakout data if it's available, as well as maps that can help to tell the story of the issue in your community. And just keep in mind that these visualizations can all be downloaded using this icon at the top right. And then you can insert those into your grant application or maybe even a report. So this line graph that we're looking up on top here, every indicator detail page will have that, and it's going to show you how is your indicator tracking over time. So you could use this to see what is the current level of this issue in my community, and then also monitor any changes. And then if breakout data were available, so for example, maybe data broken out by race or ethnicity, there would also be graphs shown there, but unfortunately, this example that I picked doesn't have that. And I know Libby's going to be touching upon that a little bit later as far as, how the data on the site can be used to identify those populations that may be disproportionately affected by an issue. And then the map on the site, so let's see, I'm just going to click on census places. For this particular indication, only available for Cuyahoga County, so that's why a county map wasn't showing. But you can click above the map at these various geographies if you wanted to look at that indicator at a more granular level. This could help to determine, where to focus your efforts on. And I wanted to mention that not for this particular indicator, but sometimes if you click on one and you click on zip codes, it'll show you the whole region. And if you're not interested in the whole region, there is a filter up at this in the top right that you can use to look at just a particular zip code. And then I'm going to scroll down a little bit further on the page. So say you're interested in downloading the data on this page for your own use, like maybe you want to make your own graph. So you can click right here, download data, CSV. I'm just going to ask you to look at the terms of use. And then that file will pop up, which I can just really briefly show you. So again, this is a CSV file that you'll get because that map that I selected was looking at all of the census places within Cuyahoga County. You're going to see each one is listed here. And then this file will also pull in any and all measurement periods that are available and then those corresponding values. So again, you can do that if that is of interest to you. And then lastly, on the bottom of this page, I wanted to just point out that there always is a related content section. So there's like indicators, funding opportunities, promising practices, etc. that can help to understand the big picture. You might be able to see what other issues may be related to the one that your project focuses on. So again, just wanted to point that out. And before moving on, although Healthy Northeast Ohio only includes quantitative data, we would be remiss if we didn't state the importance of also incorporating qualitative data in your grant application, like, stories or quotes from those who are directly impacted by the issue, to supplement the quantitative data and also to help provide context. So next, I was just going to direct us to our demographics dashboard. So Healthy Northeast Ohio can also help with describing your community in terms of geography and demographics. So if you're not familiar, demographics dashboard includes 250 demographic variables, and these are updated annually. And this data can help to provide a clear picture of who the community members are that may benefit from your project. The demographics data within this dashboard is available at the state, the region, at the county and zip code levels. And you can see that this dashboard is organized using tabs kind of up towards the top here. So for example, we've got tab population, race, ethnicity, age, etc. And if it's easier for you, just like a quick tip, you can also view all of the demographic variables that are available in a list just by clicking up here, view all demographic variables. So like on the indicator detail page that we were just looking at, you can also download the various visualizations, so like graphs and maps that are available in this dashboard to include in your application. So I can scroll down just to give a quick sense of what is available. So again, we've got information about the population, so population by race, by ethnicity, by age group. And again, those can be downloaded just clicking that top right button. And then if you do want additional information, maybe such as a map about a specific variable, all you have to do is just click on it. So for example's sake, I'll just click on households so you can see what I mean. So here is a map. In the demographics dashboard towards the top, there's a drop down where you can select your location, and it's just defaulted to Ohio, so I didn't change that. So this map doesn't look that exciting. But if you were interested in looking at this data at a more granular again, similar to the indicator detail page, you could just click a geographic level above the map. So here I clicked zip codes. So now we're seeing households across all of the zip codes in the region. And this can be downloaded as well. And you can do a little bit more as far as like turning labels on and off, changing the background, etc. on these maps. So again, that is the demographics dashboard. I encourage you to check that out. I also wanted to just very briefly share that if you also wanted to include information about your community, such as transportation or maybe broadband service data, the website also has a social determinants of health curated dashboard, which navigated to using the search for data page. But this dashboard can be filtered by location using the drop-down arrow. And it includes indicators related to things like healthcare access, education, income, housing, transportation, and so on. So again, I just wanted to point that out. And then if your project does have more of a regional footprint, like the website obviously includes data for a 9-county region, you might be interested in the regional demographics story, which I won't click on, but just point out it is in the Explore Data tab under Data Stories. And this will show various demographic variables for each county across the region. So if you wanted more of like a quick glance at the region as a whole versus having to search county by county, that would be a good place for you to go. So I think I'm going to stop there and I'm going to turn things over to Libby to share some other examples of how the site can support grant seekers.
Thank you so much, Sarah. And while I am re-sharing my screen, I'll just remind everyone to please add any questions you have into the chat, and we will make sure we address those at the end of our presentation. So I know there's a lot of information that we're sharing. We've said that a couple times, and we just want to make sure we are addressing everything that might come up during the session today. So we will go ahead and move on to the next couple of tools and features that are available on Healthy Northeast Ohio. Sarah, can you confirm that you're seeing my screen?
I am.
Okay, thank you so much. So we're going to continue to discuss some of these tools and features, especially ones that can be used for case building when working on a grant proposal. And a great beginner's tool we want to highlight is the Topic Center. So for those of you who might be new to Healthy Northeast Ohio, and just as a reminder for those who are just or for those who have visited us before, we have a footer that stays the same as you navigate through all of the different pages on Healthy Northeast Ohio. And this links you to our Topic Center. So if you click on any of these icons, it will take you to our Topic Center function, which can be specifically used to find related content that's available on Healthy Northeast Ohio. I'll click Community just to get our example kicked off here. So by clicking on these icons, it's going to direct you to all of that content that's available. And this is very broad since we're looking at community. So if I wanted to tailor that a little bit and I knew I was interested in looking for information about maternal, fetal, and infant health, I could use the drop-down arrow to refine that search a little bit. And now it will show links to some different data indicators that are available for the topic. We have all sorts of articles, promising practices, resources, and so forth that would be available for that as well. So again, this is a really great beginner's tool to help you with navigating the website. It might be a little bit intimidating to know where to start looking for information. So this is just one of those quick tricks for you to keep in your tool belt as you're navigating Healthy Northeast Ohio. So we are going to spend the next couple of minutes in this Explore Data tab focusing on some tools that can specifically be helpful. So a tool that I want to showcase next is our specialty dashboard for the Healthy People 2030 Progress Tracker. And this is very helpful for drawing comparisons in your community. This is a dashboard that shows how a location is comparing to Healthy People 2030's national 10-year objectives for improving the health of Americans. So it is pretty specific, but it can be used to identify needs and priority populations, and it can also be effective for helping setting goals and checking progress. So this dashboard is available at various geographic levels, and you can change that using this drop-down arrow, which you'll see in a couple of the other dashboards we're going to look at this morning. So if, for example, I wanted to tailor it down to Ashland County, you'll see that it pulls up the indicators that are available for that geographic area that are aligned with Healthy People to 2030's objectives. And it's also going to show whether or not that indicator does meet the current target for Healthy People 2030. And again, I'll just remind you, Sarah mentioned this on the indicator detail page, but we do have a legend on the left side of the page that can tell you a little bit more about what the colors and different icons mean as well. So you could click on any of these indicators to click on that to get to that indicator detail page that Sarah previewed. You can also view these, and this is just another quick trick for you. You can view these in card form. So this might be a way to display this information in a little bit more of an appealing way than just the list view here. And if you wanted to, you could even save these cards. So for example, if you were submitting a grant proposal related to cancer prevention and you wanted to add some information about how cancer is meeting the current Healthy People 2030 targets in your area, these could be cards that you upload to that report or that proposal. Another tool that is very useful for making comparisons in your community is our custom dashboard feature. So you're going to find that in this same section. And custom dashboards can help you to identify indicators of interest that are available on Healthy Northeast Ohio. I know we've said a couple times we have 300 plus health and quality of life indicators. We have over 200 demographic indicators. So this is just a great way to bring together selected data into one place, and it really shows a summary of the indicators of interest and any available comparisons that we have for those indicators too. These comparisons can be displayed, which is great. So the custom dashboards can also help with tracking progress and identifying those areas of need. We have a video tutorial, and again, in some of those supporting documents, we go through step by step how to utilize this feature. And very quickly, you can see here that you can filter a custom dashboard based on location, you can filter by topic, and so forth. You also have an option to pick specific indicators of interest. So if you're a little bit more familiar with all of the indicators on Healthy Northeast Ohio, you might know that you're looking specifically for something that you could select here. But for today's demonstration and for time's sake, we will go ahead and look at a pre-made custom dashboard that we created for Cuyahoga County and also for Cleveland, and we focused it on alcohol and drug use. So on this dashboard, you can see that the indicators are focused on alcohol and drug use for the areas that we selected geographically. All of the comparisons that are available for the indicators in this dashboard can be seen here on the right. Again, you can dig into an indicator and click on that to see the indicator detail page. Again, you can view these in a little bit of a different way if you wanted to see these in the card form, and this is just a great way to visualize them differently as well. One of the really great features about custom dashboards is that they support collaboration because of how easily they can be shared with either coworkers of yours, community partners, and this can really allow you to look at shared data and look at common data for measuring and tracking progress. So up here at the top, and I'll click out of that really briefly, but you'll see that there's a link to save a link to the search. And so you can save that, share it. One of the really great things too about these links is that they're dynamic. So let's say after today's webinar, you go onto Healthy Northeast Ohio and you create a custom dashboard, and in another 6 months, you forget about it and you want to revisit it. So the link that you click on 6 months from now is going to show the most up-to-date data that we have on Healthy Northeast Ohio. So that's just, again, one of the great features about the custom dashboards. So we acknowledge that there's a lot of data here and it can be a little bit overwhelming with all of the different comparisons we have. If you're doing a filter, you might have a ton of indicators that come up. And we do just really encourage you to use those filters to really narrow down that topic of interest. And that's really going to help you identify the ones that we do have that are available for what your needs are. We have a keyword search in a couple of the places on the website. I know Sarah previewed one, and sometimes that just pulls up a lot of information. So again, we just really encourage you to use these filters for supporting your needs. And that's all we're going to highlight today about the custom dashboards feature. They can certainly be utilized to support reports, presentations, publications, and grant applications as well. We are going to shift gears slightly, and we're going to highlight some tools that can assist with focusing grant efforts by visualizing people and places that might have greater needs. And the first one I want to show underneath this topic is our disparities dashboard. So again, we'll go visit that. And this is the tool that can identify disparities using data that's available on Healthy Northeast Ohio. It allows you to view indicators that have subgroup data available by race, ethnicity, age, and gender. And I'll again go ahead and narrow down our search a little bit just for a change in our example. And so you can see here that we narrowed it down to Lorain County. So if I'm looking at age-adjusted death rate due to cancer, you can see that there is subgroup data that's available for this indicator by gender and also by race ethnicity. This tool can be used to see how values differ among subgroups, and it can also be used to show how subgroup value compares to that overall value for the indicator. For grant efforts, this disparities dashboard can really help with identifying target populations or groups that are in need. So if you're looking to really focus your program efforts or policy efforts towards a specific target population, this can help justify what some of those needs are for them. And as Sarah has mentioned, and as we've seen a couple times, you can export and download these visualizations for your own internal purposes. Next up, we are going to view our Socio Needs Index Suite, which is a tool that can assist with focusing grant efforts by identifying geographic disparities. And I know this is a tool for some of our partners that was really helpful and really heavily utilized for community health needs assessments. So some of you might be a little bit familiar with this, but this is a tool that Conduent developed that we have access to on healthyneo.org. And it is made up of 3 indices, as you see here. Each index summarizes multiple health and socioeconomic indicators into a composite score to help identify under-resourced areas that are at the county or zip code levels. And because data is available in these indices at the sub-county level, it allows you to be a little more specific when planning local prevention and early intervention efforts, because you can take a look at what the needs are by zip code and again by county. So that can be really useful. So there are 3 indices that make this index up. First, we have our Health Equity Index, which is a measure of socioeconomic need that's correlated with poor health outcomes. And this can be used to identify areas that are at the highest risk for experiencing health inequities. We also have our Food Insecurity Index, and this, of course, measures food accessibility that's correlated with economic and household hardship. This is a great tool to use for identifying areas at highest risk for experiencing food insecurity. And lastly, the one we'll probably spend the most time on for today is our Mental Health Index. And this is a measure of socioeconomic and health factors correlated with self-reported poor mental health. The Mental Health Index provides a visual of mental health in the region. It can be really useful to identify areas at the highest risk for experiencing poor mental health. And so again, for time's sake, we're only going to preview one of these. They all operate very similar, which you'll see if you start clicking into them. Again, this mental health index can be used to identify the areas at the highest risk for experiencing poor mental health. And there are some filter options at the top that you can toggle between to narrow down your view. So we'll go ahead and keep it at the zip code level, but let's say I want to look at the mental health index for Medina County. So now it's going to show all of the zip codes for Medina County. And also at the top, I'll just mention that you can change the measurement period, and you'll see here that we are looking at the most recent data that's available for this index. And how does this work? You can learn all about this in a couple of these links, but we will just briefly mention how it works so you have a sense of it. So all of the geographic locations in the mental health index they're going to be given an index value from 0 to 100, and 0 is low need and 100 being high need. And to find those areas that are of the highest need, the locations that we select are then going to be ranked from 1 to 5, with 1 indicating low need and 5 indicating high need. And that's based on their index value relative to similar locations in our Healthy Northeast Ohio region. So For this map, what does that all mean? For this map, you'll see that the darker the purple, the higher the need. And there's a legend down here in the left-hand corner. So you can see that some of these zip codes, of course, have darker shades, indicating that they have higher mental health needs than some of the lighter shades. Again, with many of our other data tools on the site, you can also download this as a CSV file if you only wanted the data. You can download and save any of the charts that are available. With the maps, Sarah mentioned this too, there are some great opportunities to turn on and off. You can change the background of, you can zoom in and out on the maps if you wanted to hone in on a specific area. So a couple of great opportunities and a couple of different ways to utilize that map here. The Food Insecurity Index and the Health Equity Index, again, operate in a very similar way as the one we're looking at now, with the darker shades of their respective maps also indicating a greater area of needs. So if you wanted to, very quickly toggle through these, you could do so at the top here. Okay, and the final tool that I'm going to preview before we turn it back over to Sarah is our location report builder, which is the last thing I'll show for today. And that's under Build a Custom Dashboard, or I'm sorry, Build a Custom Report here in the Explore Data section. This is the actual web page. I'll briefly display a report just to give you a sense of what this tool can accomplish and what this tool can be used for. So the location report builder does allow you to build customized reports based on indicators on Healthy Northeast Ohio and based on locations that you have that are of interest. It can be used to very quickly pull together many different components on Healthy Northeast Ohio into a downloadable PDF. These can be very easily shared with others, and they can help tell the story of your community. They can be very tailored. So if you wanted to create a custom report that's a community profile, you could do so, or you could do one that highlights a specific topic of interest. In the example you see displayed here, we have the demographics of Ashtabula County pulled together into a report, and we have a couple of different charts and graphs that are utilized. And again, it's just a nice composite PDF. These reports are a true snapshot in time. I'll just call your attention to the timestamp at the bottom. So unlike the dashboards we looked at a couple of moments ago, these are only going to show the data as it was when you created and downloaded the report. So it's not going to update as the link does when you're creating a custom dashboard. So that makes it a little bit different, and we did just want to give that caveat. So for time's sake, I'm not necessarily going to walk through how we created this, but I'll show you, and I'll call your attention to a couple of great resources for that. We do have a video tutorial on how to build a custom report. We also have a step-by-step guide, but essentially when you're on this page, you would start to build that report by selecting a location. And then from there, you can add indicators, demographics information, you can add in some custom text and so forth. We have abilities to add some lines to break it up. You can change the sizing of different components on the report. And so eventually you would get something that looks similar to this product. And with that, Sarah, I will go ahead and turn it back over to you for a couple of our final features before we wrap up for today.
Thanks, Libby. Can you confirm again that you're seeing the website for me?
Yes, I'm seeing promising practices.
Okay, perfect. All right. So the last example that we're going to be sharing of how the site supports grant seekers is the Promising Practices database. So again, if you're not familiar, this database includes more than 2,000 practices that are ranked from good ideas all the way to evidence-based practices. And it allows you to explore what is being done now, as well as find practices to implement in your project to take action on the issue that you have identified. So as you can see to the right on my screen, there are search filters that you can use to narrow this down because, like I mentioned, there's over 2,000 of these practices in here, which is not very feasible to search through. So definitely recommend using some filters. So for example, you could include a keyword search here. also narrow it down. Maybe you're only interested in looking at evidence-based practices. You can narrow it down by a primary target audience. I'll just pick children for sake of example, topic areas, as well as geographic types. So once you select your filters and you click search, your results are shown. So I'm still seeing 225. So I definitely might want to add in a keyword to my search to just make this a little bit more doable. So I did want to share, like Livy mentioned, with the custom dashboard feature on the site, you can also save a link and share it in the practices database. If you can see my arrow just below search filters, you can save a link to this search. So again, you might want to share that with partners who you may be collaborating on with your project, or maybe just for your own purposes. So if you want to learn more about a particular promising practice, if one looks of interest, all you have to do is just click on the name. So I'll just click on this first one, for example's sake. So on this page, you're going to see a description of the promising practice. There's information like impact, results, accomplishments, and then you'll actually even see the contact information for the primary contact for the particular practice that you clicked on. So if you wanted to get in touch with them to learn more, and then at the bottom of the page, like other areas on the site, you'll also see related content. So you can look at some data that may be related to the practice that you're looking at, some other resources as well. And then at the top right in this box, you will see other related promising practices if you want to keep searching. And then I also wanted to share, and I'll just go back to the main page. So after your project has been completed, you actually have the opportunity to submit perhaps your own intervention or practice to be considered for inclusion in the Promising Practices database. So if you can see this raspberry button here, where it says submit a promising practice, you can just click on that, and then your submission will actually be vetted and reviewed by our website vendor, Conduent. So again, just a great opportunity to, share your own successes in your own work. So I think that's the last item that we wanted to share on the website. So I'm just going to go ahead and share our slides once more. Oh, I think it's going on my other screen. Let's see. Libby, are you able to see the shared version of my slides?
I'm seeing I'm not seeing them displayed in the slideshow view quite yet, but I can see your summary slide.
Okay, interesting. It's doing it on my other screen, which I'm
and I can
not
always
sure
pull it
why.
up too, Sarah.
I'm going to try one more time. Nope. Okay, I'll just share my other screen maybe. Sorry about that. Are you seeing it now, Libby?
Yes.
The slides? Oh, and of course it clicked forward. Sorry about that. Okay, we're set now. So now that we've covered ways that Healthy Northeast Ohio can support grant seekers, we also wanted to move into sharing some information about how the site can be used by grant-making organizations to inform alignment with local health improvement priorities and efforts. So to start, we do have two what I will call call to actions for grant makers. So first, grant makers are encouraged to add healthyneo.org to their application process. So this ensures that their grantees are using up-to-date data that is from credible sources. And it also encourages grantees to use the Promising Practices database to find interventions that are evidence-based. And then second, grant makers can also add healthyneo.org to the list of data resources that they might make available to grantees on their website. Again, because Healthy Northeast Ohio is publicly available, grantees will have easy access to demographic data, health and quality of life data, and then some of those dashboards and indices that we shared that maybe they weren't aware of. And because the site has these data and other tools and resources all in one place, hopefully it can save grantees time and resources as well. And then lastly, we wanted to share that grant makers can also use Healthy Northeast Ohio to explore overlap between their funding priorities and local community health improvement goals. So for example, grant makers can access community health needs assessments and community health improvement plans or implementation strategies from the region on each of the county-specific pages on the site. And then we also do have a regional CHNA/CHIP reports resource collection within our resource library that nicely puts all of those reports into one place. So if we have any grant makers on the webinar today, keep that in mind. Again, hopefully the website can be a resource to your grantees and then also a resource to you to look at that alignment. So Libby, I think I'm going to turn things back over to you to wrap us up.
Thanks so much, Sarah. And thank you for displaying the slides. Okay, great. We're going to summarize here and we're going to start to wrap up. We know we're getting close to that 11 o'clock hour, so we have just a couple more items before we conclude for today. So to summarize, many of the features that are on Healthy Northeast Ohio can support your own grant writing, tracking, and reporting processes. And for grant makers, there are also a couple of ways that you can utilize Healthy Northeast Ohio to inform alignment with the community health efforts across our regional footprint. We do have a couple of minutes left, so we do want to open it up to questions. Please do add those to the chat, and Sarah and I will both work to monitor that. And I'll go ahead and open that up on my end. So please go ahead and add any questions that you have. We know we added a lot of information and we presented on a lot of the different tools that are available today. So we don't want anybody walking out of here necessarily feeling intimidated, but we definitely have some time to address any questions that might come up. Sarah, we do have a question about what your dog's name is, since we got a sneak peek of your puppies.
Oh goodness. In my tech issues, my dog's names are Elsa and Sven, not named after Frozen.
And then a question that we do get asked a lot that Sarah, I'll kick over to you, and that this might be of interest to everybody in the audience today. We get a lot of questions about how often data on Healthy Northeast Ohio is updated. So could you just speak to that for a couple of moments?
Sure. I realized my video's off. So I think I did briefly mention earlier, the majority of the data on the website is updated on an annual basis, but that really just depends on the source that the data is coming from. And the data on the platform that was not locally added by Libby and I, Conduit manages. So they're really good about getting that updated data available on the platform within like a few months usually of the release from the data source.
Thanks, Sarah. We did have a question come in from Diane. Would this site be helpful for the veterans demographic, or do we have another resource for that?
And Diane, I'm not sure if you mean like demographics about the veteran population, or if you want to clarify, that would be helpful.
If there are other questions too, while we're waiting for clarification, we're happy to filter through those.
And I know someone did ask if the recording would be available. So if everyone didn't see my response in the chat, Libby will be sending that out to anyone who registered.
Mm-hmm. Yeah, thanks, Sarah. We'll send out the recording today. It'll be linked on our Healthy Northeast Ohio website, and it'll connect to our YouTube channel that we have for all of our webinars and video tutorials. And we'll also be sharing the infographic that we talked about at the beginning, and I think I linked it a couple times as well. So that's I think it's about two pages or so, maybe a couple more pages than that, Sarah, but it highlights all of the different tools and features that we walked through today and just how they might support both grant seekers and grant makers. So we'll include that in the follow-up as well. And Sarah, it looks like there are a couple more questions. Are all the data sets time series?
And if by that, do you mean like our multiple measurement periods available? Yes. And one of the two of the comparisons that are usually always available are comparing to a prior value, as well as looking at the trend over time. And then there's always the change over time graph up at the top of every indicator detail page. And then, Libby, I know we didn't talk about the survey, but I don't know if you want to jump into that. I saw Kristen's excellent question of the link. So I did add that link to our feedback survey, but Olivia, I can let you kick that off if you want.
Yeah, we it looks like, Sarah, there was a quick clarification from Diane about her question. So she said her goal is to find funding for major items they might need help with, like a new roof. So if there's information about the number of veterans living in poverty or who are homeless and so forth. So does that help kind of clarify that question?
It does. And I don't believe that we have many indicators or any specific to the veteran population, unfortunately. But I'm sure Libby has your email, Diane, so we can always look into that too to see if we can recommend other sources. But acknowledging that gap is actually appreciated, and we try to keep that in mind. So if there's something you're looking for that you don't see, please feel free to reach out to us. We try to advocate for adding additional information so the website is useful in your work.
Yes, thanks so much, Sarah. And I'm not seeing any other outstanding questions. And yes, no problem. You're very welcome. And I think Sarah said this too, we're also very happy to collect feedback about what might be missing from Healthy Northeast Ohio. We have a couple, and I'll just put the plug here. We have some opportunities to incorporate local data depending on the needs that it fits and whether it fits our parameters too. So if there are things that we can seek out and things that we can go back to Conduent with that might be of interest for our region, we're happy to share that feedback. And speaking of feedback, we do have a feedback survey that is linked here. You have a QR code that's displayed by Sarah, and Sarah also added the feedback survey to the chat. I'll go ahead and add that again right now as well. And this is a website user survey. So we've done this, I think, only once before, Sarah. It might have been a couple of years ago. So it's been a while since we've collected feedback from individuals who are utilizing healthyneo.org. And this is really valuable to us because we are very driven by the needs of our site users and our partners. So this tells us a little bit about what your interests are. We love providing these webinar events. We also have a regional convening event that we provide a couple times a year. And so we just want to make sure that we are addressing what the needs are of all of you. So we do encourage you to please fill that out. And Sarah, I think we might have our contact information perhaps on the slide right before or right after this one. Yes. So we'll go ahead and wrap it up. I know there's just a couple more minutes. If we see any other questions pop up as we're concluding, we'll definitely address those. But if there are no more questions, we do just want to share that you can feel free to reach out to us at any time. Please do. You can reach out to us via email. We also have a contact us page on Healthy Northeast Ohio, and we're happy to answer any questions. Like I said earlier too, we will be sending out an email follow up after the webinar and once our recording is posted. So do feel free to share that out in your networks as well. And I think we just have one more slide after this. And this concludes our webinar for today. So thank you again for your participation. We look forward to hopefully seeing and hearing from many of you again soon. And we thank you so much for your time today. So have a great day, and we look forward to seeing you again.
Thank you, everyone. Have a great day.